There's no tackle, no collision. An athlete plants a foot, changes direction, and in less than a tenth of a second, something deep inside the knee gives way. No one touched them. Yet, one of the most important ligaments in the body has just torn. This is the ACL, how it works, why it's vulnerable during certain movements, and what recovery really takes. To understand why this small ligament matters so much, it helps to see what it actually does. 4 strong ligaments help stabilize your knee by connecting bone to bone. The anterior cruciate ligament, or ACL, runs diagonally through the center of the joint, linking your thigh bone to your shin bone. It's only about the size of your finger, but it has an important job, helping stop the shin bone from sliding too far forward and limiting excessive rotation when you stop, turn, or land. Without it, the knee can feel unstable during sudden changes in movement. So, how does something this important tear without anyone touching it? Here's the surprising part. Around 70% of ACL tears are non-contact. In many cases, the problem isn't a collision, it's the movement itself. Picture a sudden stop, an awkward landing, or a hard cut to change direction. If the foot is planted and the knee rolls inward while the body keeps moving, the ligament can be loaded far beyond what it can handle. Under enough force, its fibers begin to fail and the ligament can tear. That's why ACL tears are so common in sports like soccer, basketball, and skiing. And there's a pattern worth knowing. Female athletes tear their ACLs several times more often than males in the same sports, a difference linked to anatomy, hormones, and the way the body tends to land and cut. When it happens, people often describe a loud pop or the feeling of something tearing. Within hours, the knee may swell as blood collects inside the joint. There is pain and a feeling that the knee might give way beneath you. Doctors usually begin with a physical examination. During the Lachman test, they gently pull the shin bone forward. If it moves farther than expected, the ACL may be torn. An MRI can then confirm the injury and reveal damage to the cartilage, meniscus, or nearby ligaments. A complete ACL tear usually does not heal on its own. The ligament has a limited blood supply and sits inside the fluid-filled knee joint, making it difficult for the torn ends to reconnect. Some people can regain enough stability through rehabilitation alone. Others, especially those who want to return to sports involving cutting and pivoting, may choose ACL reconstruction. During reconstruction, surgeons replace the torn ligament with a tendon graft, usually taken from the patient or a donor. The graft is secured through tunnels in the bone and gradually remodels into strong ligament-like tissue. Whether treatment involves surgery or not, rehabilitation is essential. Recovery progresses in stages, first reducing swelling and restoring range of motion, then rebuilding strength, balance, and control. After reconstruction, returning to full sport often takes 9 to 12 months, and readiness should be based on more than time alone. Returning too soon can increase the risk of another injury. Among young athletes who return to pivoting sports, about 1 in 4 may experience another ACL injury, either in the reconstructed knee or the other knee. Risk can also be reduced. Training that improves landing and cutting technique and strengthens the hips, core, and hamstrings can lower ACL injury rates, particularly in female athletes. The ACL is a small ligament deep inside the knee that helps control forward movement and rotation. It can tear in an instant, often without contact, and recovery can take many months. But targeted training can reduce the risk of injury. If you found this useful, subscribe. We break down how the body works, one part at a time,